It was actually kind of a fluke that I ended up in the dental field. There was the dentist that I worked for in Texas, the first office that I worked at, and she liked to hire people that didn't have any experience. So I went in one day and had a working interview and fell in love with it. So I just stuck with it. This is the first office that I've been at where you can come and do everything in one place. I've always worked with just general dentistry, but here we have implants and the surgical aspect of it. We get the patients back and we seat them, and we assist the doctor with anything that he or she may need, and we flip the rooms and do anything that we can to help the patient. A lot of them are nervous whenever they come in, but most of the time, by the time they leave, they're family. So it's really nice. We have a good patient base here. The staff here is wonderful. Obviously, we're all like a big family. And the doctors, I like working for doctors that have integrity, that back their work. But it's a really comfortable atmosphere. The people here are really great. We have a lot to offer as far as meeting a patient's needs. We're actually really up to date as far as technology goes. We have the digital x-rays and we have the CT scan machine, and we just have a lot of different services as far as the technology goes. And it helps us a lot, especially because dentistry's grown by leaps and bounds. A lot of the people coming from film x-rays versus digital x-rays, you can pull them up on the screen, you can show the patient, you can point out little things and nitpick, and they can see it first off for themselves. You can take intraoral photos, which will show a patient, if they have a crack in the tooth or a leaky filling or something like that. They can actually see it for themselves versus just taking your word for it. So it's easier for them to put trust in us. We take continuing courses to just keep our certification updated, and it all depends on the different courses that they have available. I like dentistry because we can have a patient come in and we can get them out of pain the same day in most cases, and then they leave and they're more at ease. They're able to go home and sleep if they need to, or eat, or smile again. And that's probably the biggest feel-good moment, I guess you could say, whenever it comes to a patient leaving and they're happy with the service that they got, and you're able to make their day better.